Hi everyone, today's topic is knee joint. Is very important joint because most of there's the ladies about the age group of above 45, they suffers from the knee joint pain, and that knee joint pain is due to the arthritis, which is more common in ladies in the earlier age group, and male also suffered that but in the later age group, about 10 years later than the females. Now, how this joint is formed, you will see, you will visualize this is the knee joint, and this knee joint is formed by the lower articular surface of the femur, the upper articular surface of the tibia, and the posterior articular surface of the patella. Again I will show the real bones. You will see, you concentrate, this is the lower articular surface of the femur. It looks like this. You will see this is smooth, and it is more smooth when it is covered by the articular hyaline cartilage. Again this is the tibial plateau. You see this is the upper end of the tibia, which is known as the tibial plateau. It also covered by the articular hyaline cartilage, and this is very smooth. It is so smooth that it is more smoother than the mechanical joint is. And this is the patella, which is in the Hindi it is known as the gutna, or in Bengali it is the malai chaki, and in English it is the patella. So posterior articular surface of the patella, it forms the knee joint. Next thing, what you will see, so when there is joint, the junction between two or more bones, that becomes tightened by means of the ligament. Now what are the ligaments you will see? You will see first there is no joint is visible. You will see there are only the capsular ligament, and before that the capsular ligament, the joint is covered on all sides by the muscles. Now you will see this what is the capsular ligament at the lower end of the femur. You will see this green color represents the capsule here. It starts anteriorly, there is a gap because the joint cavity communicate with by means of a purse-like pocket which is known as the bursa, and it contains the synovial fluid. And you will see the capsular ligament, it starts on the either side of the bursa, then it goes half centimeter away from the articular margin on the medial condyle of the femur, then it is in the articular margin, then it is at the intercondylar area. Next you will see this goes upwards and the laterally, and the capsular ligament is actually, what we will see, it will include a groove, that is the groove for the popliteus. So this is the capsular attachment of the lower end of the femur. Now what is the capsular attachment of the tibia? You see here I represent this line as the blue line. So when the capsule is attached on either surface, you cannot visualize the knee joint. So what is the attachment at the tibia? Anteriorly there is a gap for the ligamentum patelli, and on the either side of the ligamentum patelli it ascends upwards. Ultimately it goes at the articular margin, and on the lateral aspect of the lateral condyle there is a gap for the passage of a tendon that is known as the tendon of the popliteus. So this is the capsular ligament of the knee joint. Now this capsular ligament is thickened on the lateral side and on the medial side by another two ligaments. On the medial side there is a broad ligament which is known as the medial ligament of the knee joint. And this medial ligament of the knee joint has got a superficial and a deep part. The superficial part is attached to the shaft of the tibia. You will see the medial ligament, and this medial ligament is fused with a portion of the cartilage which is known as the medial semilunar cartilage. And this medial semilunar cartilage, you will see, it is a cushion between the two bones. That is, this is the medial semilunar cartilage. You can see here. So this is a cushion between the lower end of the femur and the upper end of the tibia. So this medial collateral ligament or medial ligament of the knee joint is fused with this margin, that is the margin of the semilunar cartilage. You will see. So why it is important? Because during the football playing, when somebody is in bent position and it passes the ball towards the opposite side, then what will happen? There is a fall, and that fall produces tear of this medial collateral ligament, and there is also tear of the medial meniscus. So this is severe pain, and the footballer is unable to get up. So it requires immediate operation. So this is the medial and lateral collateral ligament. This is the very thickened band. One can palpate it in the lateral side of the knee joint. So, but this is not fused with the lateral, that is the lateral semilunar cartilage. So these are the main ligaments of the knee joint. Now you will see the semilunar cartilage, the medial semilunar cartilage, that is, you will see it is more or less semilunar in shape. But the lateral one, you see, if I make the lateral one, you will see here that is semicircular, not semilunar. So this is the difference between the two. This is the medial one is the semilunar and the lateral one is the semicircular. Next thing, these ligaments, they are the extra-articular ligament. There are ligaments also, they are known as the intra-articular ligament. What are the intra-articular ligament? You will see here, there is, if I show this knee joint, that means the movement, in the extreme flexion condition, I remove the rectus femoris and I bend the knee joint. You will see in the inside there are two ligaments. One ligament is known as the anterior cruciate ligament and another is known as the posterior cruciate ligament. This cruciate ligament, it actually holds the tibia and the femur together. So this is the attachment of the cruciate ligament and the intra-articular ligament. Now what are the movement of the knee joint? Movement is chiefly, this is the flexion and the extension. The muscle that produces the flexion, that lies in the back of the thigh, you can feel all the muscles. So they are the hamstring group of muscle, and the muscles that forms the extension of the knee joint, these are the muscles that is known as the quadriceps femoris. Now how this quadriceps femoris is formed? It is formed by the vastus medialis muscle. This is the vastus medialis, this is the vastus lateralis, and this thing is known as the rectus femoris, behind which lies the vastus intermedius. So these are the extensor of the knee. Now there are some degree of rotational movement, whether it is very small, because of the spiral profile of this femoral condyle. You will see the femoral condyle, there is this profile is that is oblong in shape, and this transverse axis changes when there is movement of the knee joint from flexion to extension. So due to this there is a bit rotational movement, and that is known as the conjunct rotation in association with flexion and extension, and adjunct rotation that is free of that is the flexion and the extension. Now the clinical anatomy of this joint is very interesting. You see there are about 12 bursa, that means pocket of synovial fluid is situated there. So the person who kneel down, particularly the clergyman, so there is some bursitis, inflammation of this bursa, and that is known as the clergyman knee. And you know there is the prepatellar bursa, which is actually prominent in case of the housemaid, because they wipe the room by placing this patella downwards. Now what are the other thing you will see? Apart from injury, you will see the osteoarthritis. When there is severe destruction of the articular cartilage, what will happen? The doctors advise the patient to go for the knee replacement so that his or her life becomes better. They are free of pain, and that's why you think whole of the knee is not replaced. That means the knee is replaced only the articular cartilage. If the femoral articular cartilage is damaged, the femoral articular surface is replaced. If the tibial articular surface is damaged, that is the replaced. So that whole thing, when it is replaced, only the articular cartilage, they are known as the total knee replacement. So this is the knee joint in short. So thank you everybody for inspiring me, and you suggest me for other videos.